All right, good evening. So if I told you something serious was going to happen to you that would affect your thinking, your mood, your social life, your ability to relate to others, and other major factors in your life, you would sit up and listen and take notice, wouldn't you? Well, according to the National Alliance on Mental Illness, that's also NAMI, 25% of adults experience mental health issues, a condition every year. 50% of mental health conditions begin by the age of 14, and 75% of mental health conditions develop by the age of 24. Typical changes in adolescence often hide those symptoms of mental health problems. I have special knowledge about this because my 16-year-old daughter was diagnosed 2 years ago with schizophrenia. So today I would like to address schizophrenia specifically. Let me tell you what it's not. It's not split personality or multiple personality disorder. This idea likely came from movies and TV. Schizophrenics are not normally violent. They are more likely to have violence done to them. What schizophrenia is a physically based mental brain disorder. It affects as many as 1 in 100 people. It distorts a person's ability to see and hear what is around them, and they believe things that aren't true. Some of the symptoms are they have delusions. They have beliefs that are real strong conviction, despite superior evidence to the contrary. They have hallucinations. They see things that aren't real. They're agitated and they lack interest or engagement in goal-directed behavior. This is like feeling drained of energy or interest in normal goals and unable to start or follow through things. Here's what needs to happen. First of all, they need a professional diagnosis, not from me or any lay person, but a professional. Early identification and intervention is the best hope for people with any mental illness, and it prevents further disability. They need a treatment plan. This also maximizes quality of life, and it minimizes symptoms. They need to see a psychiatrist for med evaluation and management. This is a tricky part because there's not one size that fits all. It's a lot of trial and error. And teenagers are especially hard to diagnose and treat with medications because they have so many hormone fluctuations. They need psychological treatment, regular counseling, and talk therapy. This helps with coping skills and helping them recognize the difference in reality and the voices and hallucinations. And family can really help if we learn not to sweat the small stuff and try to stick to a regular schedule. And counseling is also good for the family to learn how to best support their child and to deal with the loss of the dreams for that child. Education is important to get the school system involved. A lot of IEPs are important, which is an individualized learning plan. Teachers need to be informed of what schizophrenia is and is not, so they know what to look for. They need to be informed of the triggers that the schizophrenic has and what the schizophrenic's coping skills are. And things the patient can do for themselves are get lots of rest and try to eat a healthy diet. That's kind of hard for young adults and teenagers. They need to attend their counseling sessions and be honest with their counselor on how they're feeling, and avoid self-medicating with drugs and alcohol. The most major thing that they need to do, though, is take their medication. There's a lot of stigma with mental health issues, and people are often afraid of schizophrenics, but they shouldn't be. Um, they're people too, and it shouldn't be seen as anything evil or terrible. It's been portrayed like that in the media, but there's a lot of stigma with it. In closing, there is hope, and early detection and intervention are the best ways to treat this and preventing further disability and possibility for full recovery. Schizophrenics aren't scary or harmful to people, and educating the public is one of the best ways we can help them. So I encourage you to see the person, not the illness. And thank you for letting me talk to you today.